everybody, to today's IC 360 pop-up executive webinar series. And in today, we're going to be featuring Cindy Lehnhoff, and Cindy will be joining us today to discuss several different topics, but mainly one specific to advocacy. We're going to talk about that a little bit more in just a few moments. Right now, what we are going to do is we're going to go through just a few housekeeping items along with what our agenda is. So one of the things that you will find out with our webinar series is you'll see at the bottom of your screen that there's a chat function as well as a Q&A function. Now, hopefully we'll have some time to go through Q&As, and I think we will today. But with that, we ask you that you ask any of your questions through the Q&A function. And when you are putting them through the Q&A function, to please look to others who have maybe put the same question up there. If you click like on that one, it'll bring that one to the top. So we look to answer it sooner. Hans, our leader of marketing, will be back there also working with you. If you have a chat question, you can ask him during our webinar today, and he'll be sure to respond back to you as soon as he can to get any of your needs met. And this is being recorded. As always, we are recording these sessions, and within a couple days after, because working with Zoom, it takes us a couple days to do a production on it. We will get this back out there if you have registered for this webinar, whether you are on today or for those who are now hearing this because they weren't able to make it. There will be a Q&A section as we talked about, but there's also a certificate that you will receive if you so deem that you would like it for attending this for 1 hour's worth of training. And we're very happy and pleased to present this to you. As always, if you have questions after, please do not hesitate to send questions to myself, to our presenter like Cindy, or to Hans, so we can be highly responsive to you. And with that, what we're going to do is for our agenda today is we're going to go through a few of our traditional Inspired Care 360 housekeeping items for our members who are in attendance, as well as we'll then go through and introduce Cindy a little bit further. And we are going to talk about, and Cindy's going to talk about today, creating one ECE voice post-COVID-19. We're going to then go through some question and answers, and then we'll have our wrap up. So with that, no further ado, we will start moving forward. And let's move ahead. And well, actually, we're going to present and at least introduce you here first, because I see the slide popped up first. So Cindy is the director of the National Child Care Association, with many years of experiences, both of management executive level within the child care industry, as well as being now the director of the NCCA. Welcome, Cindy. How are you doing?
Thank you, Tony, for having me today, and to all of the providers out there participating. I'm doing well. How about yourself?
Doing absolutely great. We were just talking a little bit, as you guys all saw, so there's no fake here like you see with the home shows on the Home Improvement Network or TLC or any of those things where they've all set the stage and act like they've met each other for the first time. Cindy and I have got to know each other over the past couple of weeks, and we were just talking about the fact that she's in Daytona. I'm actually down in South Florida myself. So we are doing our best to not only distance, but hopefully distance in areas that are in nice places. But this is where you live, Cindy, right?
It is where I live. I ended my childcare, my 36-year childcare career here. I relocated here and spent 6 years working in 4 of the states, the Southeast states, including Florida, for the company I worked for.
That's awesome. Well, we're so happy to have you today for our webinar, and we're going to go ahead and get started. But before we do, we're going to go through a couple of housekeeping items. So please bear with me. Our first one is to our members. Want to mention this again. We have something that's really exciting, and this is not only going to be for our members, but we even believe that for non-members alike, we're going to be able to bring something that we really haven't seen taken on nationally. And that is going to be an opportunity for us to provide a solution for benefits and healthcare benefits for employees at a very, reasonable rate for our teachers and for our staff. This will include both medical, dental, vision, virtual healthcare, and this is coming, and it will be starting as low as $11.50 a paycheck for those who pay weekly, as well as for our, anybody who has a full family with $90 overall for a paycheck. And for the kind of benefits, I think will be pretty incredible, like $15 office visits for specialist visits too, as well as significant discounts for drug and medical. It is specific for childcare. We built this from the ground up since last summer, and this is for the childcare and the ECE specific industry. It is also going to have an administration that is a third-party administrator, and what that means is anybody who participates with this does not have to do the heavy lifting of enrolling people. It'll all be with, enrollment for right across on your phone or on your laptop. And if you have questions, they'll talk to a consultant in a contact center who will answer and explain all the programs. So this is on its way. It's coming soon. There's no high deductible programs with this. It pays from $1, and there's 5 different levels of plans. So more for this to come. But hopefully it's sort of exciting for the entire industry. It's something we put together and are building. Another one of these items is we are bringing to market our ECE and our school executive coaching. These are mainly owners who've been very successful over a period of time, who are looking to work with other schools and environments that you're looking in different areas of specialty. Maybe it is growing your program. Maybe it is focusing on your operations. Maybe it is on dealing with cultural issues. And you would like to have someone to help coach you through that and get you and your school to the next level. IC360 is now bringing our IC360 coaching, and that is being rolled out in the next month. And we believe this is going to be a great help for not only our members, but also those who want to become members with IC360 and be part of our family. And the last one of our housekeeping is our financial strategy and decision making. A lot of owners have come to us saying, you know what, we have accountants, we have CPAs, but we really don't have individuals who help us with making the best financial decisions, either looking monthly at our numbers and are we doing good, could we do better, and or if it comes to looking at acquisitions, or maybe we are looking to sell our childcare business, or are we looking to price correctly? So we have a financial strategy and decision-making service that we are bringing on board in the month of June, and it provides a number of different services, as you can see, is looking at defining key performance indicators and really focusing on your success. So 3 new solutions coming down the pike for IC360 members, and even one of them will be rolled out to the general public. There will be obviously a higher price for that for the general public, but it is also an incentive to be part of our family. So with that said, let's move forward and let's go on over and talk to Cindy. So Cindy, here you are. This is our topic, creating our ECE voice post-COVID. Can you go ahead and tell us a little bit what you want to talk about today?
Yes, well, first of all, I just want to recognize you for the awesome services that you're going to be providing to members of your family, the childcare providers.
Yeah.
I know how important it is for those things to, be available. And thank you again for inviting me as the National Child Care Association Director to talk about the importance of advocacy. And I want to start out by saying that this is so, so important. And I think that if we ever needed advocacy, and we've always needed it, we really, really need it more than ever due to COVID.
Yeah.
What childcare lacks is a voice that has come together as an industry and speaks up for ourselves. And I'm going to say our and we, because I've been a part of this industry for 40 years. And I consider myself, somebody that has been in the trench and worked as a teacher, a director, a district manager, and even a vice president. But I've always been in the field. And I know how it feels to walk a mile in everyone's shoes and try to keep that balance of quality and financial excellence.
Yeah.
And some of the things that we could accomplish if we would really pull together, we could actually be a part of putting rules and regulations into place that affect us as an industry. And at the same time, ask for the funding to do it. We're not against regulation. We know to be high quality, there has to be rules and regulations, but we've been left out. And who are the experts who have been doing this for, almost, 50 years as an industry, and developing ourselves and our knowledge base and our abilities to do it in high quality licensed centers.
Yeah,
Rarely,
absolutely.
rarely are practitioners brought to the table for this purpose. And also, and this is something I learned myself in becoming more of an advocate than an operator, is that when the US Congress steps up and says, okay, we're going to change something about childcare to make it, higher quality, because, we know more than we did, 25 years ago about what we should be doing and what is best for young children. But they write bills and they write budgets, but they really never look at how much it costs. They don't cost it out to say how much
Right.
it costs the industry. Like, for instance, when they decided, and this was a good decision, but when it was decided that every licensed childcare center would do, FBI fingerprinting, this put a lot of cost back onto providers. And again, not that we are saying this is not the right thing to do, but there should have been some funding put behind it. And that's
Well,
an example.
well, and so I'm not, I know we're talking a little bit about some of the things you're going to talk about, and so I don't want to step on any of that, but let me ask you, Cindy, sort of just jumping in, a lot of times, many of us who are owners and operators feel like there's been, to degree that there must be some level of advocacy today nationwide. And I think we see a couple different groups out there, but it certainly feels that we don't really have a say, and that lawmakers, as well as some of the institutional higher ups, for lack of a better term, are making these decisions in a vacuum. What has been your experience of what the advocacy nationwide is, not locally, but nationwide is today? What is the current landscape?
I can tell you that because that's something that I've spent a lot of time trying to understand in this role. And from what I've experienced is that we have a lot of great national organizations that are advocates for children and providers in DC.
Mm-hmm.
However, what happens is that we're talking about maybe 10 really solid organizations. Child Care Aware is amazing. First Focus is amazing. National Women's Law Center is amazing. 0 to 3. And they write a lot of great op-eds and put out a lot of information to say what childcare needs. However, and we do the same thing, and we actually partner with them and sign on to the majority of what they're asking for. And we even go as groups to visit, our legislators on the Hill and stay in constant touch with some of those legislators that can drive, what we need.
Mm-hmm.
However, what is happening is that what I've learned in a couple of circles, and one of them at an advocacy institute that I was able to attend last year at the University of Maryland, is legislators respond better if they hear from their constituents,
Yep.
their voters. And in talking with lots of members of NCCA and even potential members, and speaking at childcare conferences since taking over the NCCA in August of this past year, is that most advocacy that providers are participating in is at the state level. And
Okay.
that's good, it's needed. But what the piece that we're missing is states can only do so much. If the federal government is only providing so much money and support to the child care block grant. And also, what about our paying customers who really need some tax breaks and credits to make child care more affordable?
Yeah.
We're not asking for that. We are not asking for that at the federal level as an industry. And, you know, you either have to have money, you know, to be heard, or you have to have a big voice. And our voice has to come together if we really want to accomplish more.
Right. And, you know, Cindy, just so I want to make sure, you know, and some people, I think even in our chat, and again, try to use Q&A, folks, but they want to know about those groups. We'll send those groups after. So you also have connectivity to those groups in addition to the NCCA. And, you know, part of the mission, what I hear you clearly saying is it's great that you have some group representation. You know, and then we have a lot of local, but what we don't have really in a strong way is national voices of childcare owners, operators together who are talking to their Congress and their senators for the national, for the federal side of it, as to just the state side. And what is, you know, just to clarify a little bit of this, what is the benefit, in your opinion, again, you know, just to summarize it, as to the federal, as to state, because I do agree with you. State, you can look at state issues, state regs, but most of the state regs and everything comes down from federal, does it not?
There are a lot of regulations that are being discussed and inserted into the child care block grant requirements. And child care block grant, development block grant, is where we receive the majority of funding that is provided to states for to pay for children that are receiving child care assistance. And so that is where a lot of it starts. And the states actually write a plan to say how they're going to comply with those federal guidelines and build them into either their QRIS or their basic licensing regulations, so that they can show and demonstrate that they're going to use the money as it was intended. And I can give you a couple of examples, especially for the providers out there, you know, that are working in areas that really require subsidy payments for children, because that's what their neighborhood is and that's who their customer is that right now, last year, for instance, the federal government does a budget every year. I think most, you know, of us as taxpayers know that. And there's discretionary and non-discretionary budgeting. And believe it or not, childcare is discretionary.
Yeah.
And so last year we had a budget
Amazing.
that was approved at $4.79 trillion for our country. And less than 7% of that was put into the children's share of the budget. And when I say children, I mean less than 7% of $4.79 million went into all children's budgeting. That's K through 12, that's child care.
Well, let me ask you, you mentioned two numbers. I just want to clarify, 4.79 trillion, million, or billion?
It's our total US budget is $4.79 trillion.
Trillion. Okay, very good. That's a huge amount. And then 7% of it, though, which isn't a huge amount exactly, is put into everything under the umbrella of childcare.
No, it's put into the umbrella of children.
Children.
And that includes K through 12 education, foster care, food subsidies, medical subsidies, all of the above. And so out of that was $3.738 billion.
Okay.
Now let me tell you how much child care got, or early childhood education got. 16.7 billion.
Okay, 16.7 billion.
Right, that was childcare. And the childcare block grant was only $5.8 billion of that. Over
Well, and say again, finish that statement.
and over 10 billion of it went to Head Start. Now, I am not at all saying that Head Start got too much. What I'm
Right.
saying is that Head Start did receive double the amount, and this has been, you know, a tradition double the amount of money that child care providers got in the block grant, and they serve almost 500,000 less children than is
Wow.
served. Yes. And that brings me to one of your questions is, what if we'd been better prepared for COVID-19?
Yeah. Before we get to that, can I ask you a question about what you told us about?
Yeah.
Okay, and I want to hold that because I do want to talk about getting us prepared. What would get us better prepared? I think that is a hallmark of what we're trying to talk about today. We talk about the block grant. We talk about Head Start. You know, I'm a child care owner that I have 3 centers today. I've had 6 in the past. Of the 3, one of them takes 25% social service. Another one, oh, we might have had a little stick for Cindy.
Yeah,
Cindy,
we did. Can you see
okay.
me?
We
Yeah.
can see you again. There you go. So
Okay.
just to start again with the question is, you know, we talked about the, you know, both the block grant, which goes to a lot of the social service funding of our programs, as well as the Head Start program. And a lot of times with childcare owners, you either are or you're not Head Start. A lot more obviously are social service funded, but you know, giving you example for myself with my programs, in addition to running and operating Inspire Care 360, I have 3 centers. I've had up to 6 centers in the past. Of my 3 centers, one of them has 25% social service children. Another one has 40%, and one of them has none at all. Okay. Before we get on to being better prepared for the COVID-19 part, the ones that are, because you don't have any at all, social services, shouldn't the federal government have a level of support even for those to stay afloat? Because those have become very challenging in itself that are private pay. And not saying that you need to have exactly funding, but they have talked nationally about, you know, adding value to, you know, fund teachers and the value of teachers, because a lot of times, you know, we have a lot of significant issues. Once you get a great teacher working for you, and if they perchance have a master's degree, the local public school system will just pull them away from you in a second because of all the kind of financial and the benefits that they can offer. Is there benefits nationally that can benefit those who might have just private pay environments too, in addition just to social services?
The answer to that question is yes. I don't know that as much has been explored, you know, to say how best to do that. But that's another issue where if we as, you know, licensed private providers would come together and have a committee of people to say, what would help us accomplish that? Because it really has to be accomplished. Right now, many families are paying between 10 and 14% of their childcare cost because they I'm sorry, 10 to 14% of their income goes to childcare cost.
Yeah.
Studies have shown for years that once it gets past 7%, parents start to struggle. So
Right.
right now, the average is between 10 and 14%, which is, as you point out, we're seeing parents struggle, providers can't raise their rates. Well, one of the solutions that has been brought forth, but again, we are not asking for it as an industry, only a handful of organizations are doing it for us, and it's not got enough might behind it. And we really need to get parents on board with this too, is that the tax credits and that are in place currently are so ancient. We
Right.
haven't moved that tax credit to go along with what it costs to produce a high quality program. And that would certainly help parents with being able to afford to pay more for their care.
Yeah, well, I see, and we all see an article at least once a year, whether it be in our local paper, whether it be in national papers, that talk about, the cost of care exceeding that of community colleges and the like. Number one, my response always back is, well, we have the child for 10 hours a day. We are wiping their butts and they're not out drinking and smoking. So,
Exactly.
so it's well worth it. But I understand from the parents' plight, right? And a lot of us are parents, and we know how costly it is and what it does to our parents, and that makes us all really challenged with making. This is one of the really important parts of why I think Cindy is so important here for everybody who's on there. We have a tough time oftentimes, and even in the face of COVID, which we'll talk about in a minute, but we have a real challenge in asking families for increases because the cost is so burdensome. But a lot of times our costs come from regulations. They come from state requirements, that come from federal requirements. And without a voice, we're really challenged with helping families pay for it as well as ourselves as owners. And we sort of get sandwiched in between. So I really think that's the value of what NCCA's vision is, materializing for me, or coming up to my mind at least. So, sorry, back to you on my little rant, Cindy.
Oh no, your rant is exactly right. And we need to take our rant, further, and of course, put it into a unified voice with the facts, which all of the advocacy groups that, I mentioned earlier provide us with amazing facts. And actually, one of the things that each of these groups allows for us to do, and in some of them, we pay to participate. They allow us to share the facts and the data with our members. And they actually give us what we call action alerts that we have posted on social media and on our website, and sending out emails to our members to say, at the push of a button, you can tell your congressman in DC what you need and why you need it. And that's the beauty of being a member of a group like NCCA, and and having those opportunities, because we know we need to simplify it. We know that providers, I was a provider, I know how busy we are and how hard everyone works in this industry, and the long days. And actually it's a bit frustrating for some of us that have taken this on, and we feel like we're not being heard because we know that enough constituents aren't out there. So that was one of the reasons why that the NCCA said, when we redeveloped our mission statement and we actually have new owners, to say we are going to help providers come to their own defense and ultimately be a part of the solution. And right, because right now most people just have an opinion, they're not offering a solution. And
right.
it comes down, so they get very frustrated with their state agencies, and some of the state agencies still are not utilizing the money they do have to really do what is necessary to ensure that providers have the money they need to do business. And I don't know if anybody out there has ever had this experience, but I know from my own experience that there was a time where that if you had a center like you have, Tony, with the 40-60, vision, is that the pricing was pushed up for the paying customers because there was
you're not getting paid enough for the social service families.
Right, and that's got to stop.
Yeah.
I mean, that's part of the solution, is that the Child Care Block Grant gives a lot of flexibility to states in setting price and who gets the money. And right now, I don't think a lot of people realize that the Child Care Block Grant allows the flexibility for states to pay money to unlicensed providers of child care.
Wow. No, that's pretty amazing.
Yeah, so think about that. They're going to charge a lot less if they're in a, in a faith-based situation because they can. And I'm not against faith-based either, as long as we're all following the same rules and regulations.
Yeah.
And and childcare has become so much more than care. It's become early education, and that's the big miss right now.
Well, and that's what I was going to say. So we did get a question from Tracy Frederick, and I'm going to try to summarize what she was saying. Is it's to her understanding, there's the Department of Education, for underneath children altogether, which you talked earlier. There's the Department of Education, and then there's the Department of Health and Human Services, which we know that like the block grants and the like come out of. Wouldn't it be more streamlined for us if we were all together? Because I think what happened is when this was all written, childcare was preschool, it was nursery school, it wasn't even education, it was daycare. And now it's really become ECE. It has become early education and care. And, do you see any efforts or any kind of conversation to bring them to streamline it as part of the journey a child makes from birth all the way from, then to K through 12 to be, looked at in, a streamlined view?
Well, there certainly has been a lot of conversation around that. Back when I was in Oklahoma and providing multi-site leadership to a large group of providers there, that was in discussion, but it has never taken off. Maryland has already done that. However, what I think is happening based on talking, because the Maryland Child Care Association is a part of our of NCCA, and what is happening is that they're still treated differently. Okay,
Yeah.
so there hasn't been a streamline. There hasn't been anything that says, okay, we're going to pay that degreed pre-K teacher, at a private licensed childcare center the same amount of money that we pay the degreed pre-K teacher in a public setting.
Yeah.
And so it has not come together the way it should. So what we would again have to accomplish is, and becoming part of NCCA, and we've put out some feelers for this. We need some committees that can come up with solutions and ways to do this so that we can present it to the powers that be, and that we already have the answers and the solutions and actually what it's going to cost, and include that in our advocacy.
See, and that's very helpful. So that's a great opportunity to dovetail like what you were about to talk about of what would we have been if we were prepared prior to COVID, and what would we be, what would be a future state look like if we have that voice, that NCCA could help us gather that voice. So what are your thoughts about if we were better prepared?
Well, that's interesting. Oh gosh, my electricity just blinked.
Yeah, and you're either moving a lot of furniture, there's a big storm coming through.
I guess I could join by phone. I don't know though, but I don't know, but anyway, let's go to your question. All right, I really have, spent some time imagining that over the last few weeks. And I have limited myself to too big of a picture, because what I'd like to think about, like it's all to think about, is one of the things that state child care associations have been begging their states to do for many years, and I've been part of the group begging, and that's kind of, advocacy with a twist, because it becomes, begging, is that why is it that child care cannot be treated similar to, and children that are receiving block grant funds, similar to children in Head Start? Because in Head Start, children are paid on a contractual basis. So you enroll in Head Start, and that child is enrolled for the year, and those funds are paid whether or not your child attends every day. And
Right.
ultimately, the continuity of care for that child is already there. And I've talked to a Head Start teacher that lives here in my neighborhood, and they haven't had to apply for PPP funds. You know, they haven't had to worry about additional money in the child care block grant because they're being paid because they are paid by contract. And what happens in childcare, and I know that the people I'm talking to know this, in the majority of states, it's attendance-based only with minimal absence days. So had we been on the contractual agreement that Head Start is, we would be paid out our year for the children
Wow.
we're serving. And so that's one of the things that we have to accomplish in the block grant is we have to do away with the flexibility that states have, you know, to remove this very important piece. And now with social distancing and trying to keep groups of smaller groups of children together, you know, more than ever, we're going to need to be able to guarantee that children are in the same place with the same teacher and the same classmates in smaller groups. Also, if early childhood providers had been paid fairly all along, if we had, you know, been able to get the level of funding that it takes to really produce a high quality program, and we all know we haven't because we're working on slim margins in, you know, most cases, and that's just, we've accepted that. In fact, we sometimes are grateful for so little, and it's all right to be grateful, but not to the detriment of ourselves, because, you know, we're hardworking people. So had we been more assertive, like for instance, last year, the advocacy groups that we work with, and including NCCA, asked for $5 billion more in the block grant. Guess what we got? $550 million to be distributed among 50 states. So really hardly anything at all. Well, if we've been reimbursed at a higher rate, the block grant, we need to say also with the block grant, this has got to be a part of our advocacy. We can no longer recommend that states pay at the market rate, or we need to require they pay at the market rate.
Right.
That in itself will also manage pricing better for centers, for private pay customers.
Well, and it's a lot of reasons too why owners make conscious decisions whether or not they're going to accept social service programs. And that really is a struggle for some communities. You know, but it's also a struggle for the centers themselves because, you know, candidly, when times do get tough, it is nice that you do have those social service programs in there, because a lot of private paid families will decide to keep kids home. And so having a social service program is very valuable to your center. But if they're paying under market, or you don't know what it's going to be next year, you know, it's always it's tricky. You know, just, you know, at IC360, we're huge believers of putting your oxygen mask on first. I love to use that phrase, Cindy. And it's a little bit about what advocacy is all about. Many of us got into this because we have a love and a passion for children education. Some of us got into this because they saw this as a valuable business that really supports the community and supports themselves. And it doesn't really matter why you got into it. But what it does matter really is the fact to keep your center so you're not on those razor thin edges, is you have to advocate for your own business. And I'm a huge believer in that, in the sense that if you don't put on your own oxygen mask first, you know, as they say on a plane, before you can help anybody else, you have to be good. Well, part of this advocacy is saying, like we talked up front, are you making the right kind of money, bringing the right kind of money in to run a healthy center? Then you can pay for good teachers. You can provide benefits to the teachers. You can then provide great service to those kids, whether or not the child is a social service child, a Head Start child, or a private paid child. It doesn't really matter where that child's finance comes from.
A child is a child, and it really should not be where one gets something better and more than the other.
Right.
To make this equitable. And one of my mantras of late is, unless we do right by providers, and we need help from providers, we need for our legislators to know the intelligent, hardworking, professional individuals that represent this industry. We
Yeah.
need them to know us. And if we don't do that, I think we're always going to be, there's always going to be a stigma about us not being worth what
So,
other education professionals, are worth. And
yeah.
we have to come forward. And again, if you're operating a center that is 35 years old, you're probably and most likely in a neighborhood that has a split of, customers as far as their social economic circumstances. And
Mhm.
everybody on this phone knows you cannot be financially healthy if you are at 50% utilization. And right now,
Nope.
of course, with COVID, it's even worse. But I would ask everybody that is a provider to think about how much money they might have had in savings, if we had been paid fairly all along for the services we provide to children, how much money they may have been able to put back in savings for, quote, the rainy day. And of course, this is bigger than a rainy day, much bigger than we had ever anticipated. But in surveying our industry out there, we have found that many people couldn't last longer than 2 to 4 weeks.
Right. Well, and I think one of the things you said early is the fact that we have a voice so people really understand what childcare ownership and operators go through, what the entire journey is like every day. And it's not a whining and complaining, say, oh, poor us. It certainly isn't. We're entrepreneurs, we're business owners, we're operators who
Exactly.
understand, we have a level of intelligence that I think is rather strong because we have a huge balance. We are, obviously endeared with children, which there's nothing more precious to anybody on the planet, right? And then on top of it, we have to be profitable. So we definitely have a journey that's really important, but I think we are living a legacy that we were just daycare providers where it was a place to drop your children off, and that's no longer the case. So there really needs to be a very strong voice. So tell us a little bit, about where we would have been like more like, you started on the part with COVID, but what would be also, um, what does that voice sound like? What does it look like if you were part of this group with NCCA? What do you see as that journey being, Cindy?
I think the journey is that NCCA can help, uh, for one thing, provide information in a condensed Reader's Digest way about what is going on in the industry and with the people advocating, so that we can help decide together, membership along with our board, what are the battles that we
Right.
want to invest our time and effort into, because we don't have the money to invest, we have time and effort, and make it easy. And I will tell you, I have read so many things that NAUIC has put out, and they're excellent. They are stating the problem. Same with First Focus. Now, the National Women's Law Center has gone as far as saying, really, what are some of the solutions? But see, that's a lot of reading. And I know that everybody out there, I didn't have time to read all that when I was a provider and a multi-site manager. So I can, along with our staff, bring that information into a Reader's Digest condensed version, ask them, what do you want? How can we help you? How can we
Right.
help you? And so that we are representing our membership, and at the same time coming up with the simple ways, for them to go to their legislator at the US level, so that
So
we are not caught up in this snowball effect of, by the time providers get involved, it's pretty much a done deal.
Oh, it makes a ton of sense. I know you wanted to launch a poll, and this is a little bit of a different one, and I want to launch this, but I'd like you to read this for everybody, and because this is a little bit longer, and I know you're seeking some feedback, and tell me why you wanted to create a poll like this.
Well, because again, we want to represent the 129,000 licensed childcare providers that are in the United States today. And we want to know what it is that NCCA can do to best represent you. Now, we've polled our members, and I know what they've said, but I'm hoping that we can get a bigger group, you know,
Sure.
come forward with that. We want to be on the right track. You know, it's a passion for me. I have just worked again in the industry. I have been parts of childcare boards. I have been parts of advisory committees to, you know, governors. And ultimately, we're not making the headway we need to make. And I would like to do that. I'm a mom and a grandmother, and I have daughters that work.
Yep.
I would like to think that what we do today will change things for the next 7 generations, which is an
Yeah.
old Indian wisdom, if you've never heard of it. I lived in Oklahoma for 30 years, and that was constantly uh, what was brought up. And if we don't change it for providers to enable them to do what they passionately want to do, we will
Yeah.
continue to see this uh, childcare and early education go somewhere else. And I'm not certain I'm comfortable with that. I've seen it done in the public schools, and I'm not necessarily impressed.
Right. No,
So
I,
that's what we'd like to do. We'd like to say, what would you expect from an organization like NCCA if you were to join? And if you could just select your top 3 answers.
yeah.
And I'd like to know what number 1 is, number 2. It'll do that for us, right, Tony?
Yeah, it certainly will. So we're running the poll right now. Because the questions are a little longer, we're giving everybody a little bit more time. But it's, you know, the question is, what would you expect from an organization like NCCA if you were to join? And I think it's important because I think Cindy coming in and taking leadership reins here, I think is saying to everybody too, and clear me up if I'm not, that this is about your voice and it's not about validating our voice. In other words, not validating NCCA of what you guys are doing, but saying, hey, we really want to represent you. So,
Absolutely. Absolutely.
so what you have here is create and conduct grassroots marketing campaigns that would make it easy for providers, teachers, and parents to actively involved in the advocacy. Number 1, funding and guidance of professional lobbyist groups to represent childcare in DC year round. And then third one is affordable professional development opportunities to keep pace with getting more staff credentialed and degreed in early childhood. You know, the fourth one is affordable professional development opportunities for directors that focus on leadership skills, business skills, and advocacy. And the last one, well, the second to last one is conferences and advocacy of gathering in DC that would allow for members to attend and actively participate under the guidance of NCCA advocacy. And the last one is other. So we're going to end the poll. And we have really the second one with narrowly the first. So funding and guiding a professional lobbyist group to represent childcare in DC year round. And as second to create and conduct grassroots marketing campaigns that would make it easy to provide teachers and parents to actively involve advocacy. What are your thoughts about that?
What are my thoughts?
Yeah.
I'm excited to know that actually what we think is a good idea in the eyes of providers, because it is a missing link. There is basically one other organization at the federal level that represents 6,000 childcare centers. And they're not geared to the representing the private licensed childcare owners. They want to keep things a little tight. Now, let me tell you, they haven't asked for anything that I haven't talked about here today. We stand with them. But when they are talking to Congress, we're talking about a handful of people representing 6,000 people. And again, if that were working, we wouldn't be where we are today. We would
Yeah.
have gotten our $5 billion last year. And so that's why until we try something new, so thank you all for letting us know that we're on the right track. And hopefully some of you will join us and become part of some of the committees that we'd like to establish and advisory groups to actually prepare our unified voice statements. And certainly, but again, for those of you that don't have time to do that, we got this.
Yeah.
We got this.
Well, and I think it's important. Again, you know, by the way, are you familiar with a group called Child Care Changemakers?
I am not, but
Yeah.
maybe I need to be.
Well, one of our attendees, David, said there's a call this evening being hosted by Child Care Changemakers to talk about how we get $100 billion from the federal government for child care. Are others on this webinar aware of this call and this movement? So I think if someone could put into the chat function if they are aware, I have not heard of it before, personally. You know, this is how we also learn about movement oftentimes, is participating in webinars and events like this, so we can bring together the brain power. How do you seek, as we get some people who might respond to that, how do you see as when you bring advocacy or you bring these owners together of gaining their understanding of what is important to them so you can represent that?
I think that, again, you know, if we can work on a network of people that really are able and willing to combine what we know. Collaboration is a great thing, and better solutions come out of collaboration. And actually, one of the things I would really encourage everybody on this call to do is find out if their state child care association, what they're doing. And if you're a member, I would love to talk to them about joining NCCA. We already have Oklahoma, Maryland, New Mexico. We already have some associations working with us, and we collaborate about what's happening and how we can take the best practices, you know, from what is occurring in their states further up the chain.
Yep.
And again, I think that if, in fact, we offer the state associations an advisory board member position. So they can do that for and with us. And I really think that, and again, even partnering with childcare change makers, a whole nother group, and you said it, it's a benefit that we learn about each other. You know, we need to come together and sit at the same table.
Yeah.
And we don't even have to, you know, divide, you know, sit at the same table, because that's what NCCA is. That's what everybody out there wants. We want change.
Yeah. Someone asked, since you represent about 6,000, said how many childcare are there in the U.S. alone? And I'll tell you, outside of the home, there's close to 65 to 70,000 childcare providers outside of home childcare providing. And so there is a tremendous.
I have that number.
Yeah.
There are 129,000 licensed childcare providers in the United States. Well, prior to COVID, there are 115,000 licensed family homes. And in the combination of those two entities, there are 2 million people that work in this as providers and staff in those licensed facilities. And right now, 335,000 of them are laid off or furloughed.
Wow.
And there are 12 million children prior to COVID that were being cared for in the licensed childcare licensed childcare. Now, keep in mind that there are millions of children out there attending childcare over and above the 12 million in licensed facilities,
Yeah.
because there are many more unlicensed situations caring for children than there are licensed.
Yeah, and that's not a surprise at all. And honestly, it doesn't play for a fair playing ground for all of us who are doing the right thing by staying licensed and following all the rules and trying to survive. But with our time super limited, with only a couple minutes left, Cindy, I think that this has been a tremendous conversation. I want to urge everybody, Inspire Care 360 is partnering up with NCCA because we are a big believer in, if you are a licensed child care facility, center facility especially, that helping you, again, put the oxygen mask on first, advocating for you to be successful is just absolutely critical. And that doesn't mean that you're just wildly profitable, but that means that you're out there meeting your vision and your mission. Part of it is not only coming to work every day and having an amazing staff and an amazing culture and growing your enrollments and operating your business, but it is representing what is important to you. So I would highly encourage you that if you are interested to reach out to Cindy. You have the email address of admin@nccanet.org. And if you have more questions, and also Cindy, I assume, within your website, they probably likely could get a lot more information too, if needed, but I'm confident that you'd be available for conversations with them.
Oh, I would absolutely love to speak to anyone that wants to speak with me. And I promise that if you leave me a message, I will get back to you.
Yeah.
It may be a few days, depending upon, how many people, contact me, but I will manage it, because again, I am committed to this, and I want to see this done, because I would like to think that we could be doing a much better job for children early on. We talk about them getting to college. We need to make sure they get a good early childhood education before, we even think about, college. And right now, colleges have a lot more opportunity to fund, their students than we do.
Yeah. So, and I think that's fantastic. A number of us are on local, within our county boards. They're within the state. They might be on different panels. Really look at those groups. One of the best ways is to look at those groups to join NCCA, possibly look at yourself as an individual to join, and what it may take for your center. But again, it's about us having a voice. And candidly, everybody, the only way we do it is by participating ourselves. We can't hope. I always say, my staff knows this, though I'll be laughing when I say this, but my last words is, hope is not a strategy. Hope has never been a strategy.
Yes.
And you cannot hope that things are going to get better. You have to execute to make things happen and make it part of your agenda. I'm not telling you should do that, but for my team, hope is never a strategy. So I want to thank you, Cindy, for this very informative conversation. I've really enjoyed it. I think, we're seeing some feedback from a number of people who are saying that they enjoyed it too. So we look forward to having maybe a follow-up conversation with you in several months. And in the meantime, I'm sure we'll help get some of your information out to our members too, as well as our general population who attend our webinars.
Well, we'll keep you informed of what we're emailing to our members, and feel free to share it with your members, because together we can be one great voice. And thanks to everybody who participated today, and, Godspeed to everybody out there right now.
Wonderful. Thank you much, Cindy. Hope you have an absolutely wonderful day.
Same to you all. Thank you. And thanks to Hans too.
Of course. Take care.
Bye.